Thanks, Emma. Good evening, everybody. Welcome to the Faculty of Nursing information session. I am Catherine Lang, and I'm the Associate Dean of the undergraduate program in the Faculty of Nursing. And I am also a nurse, in case that wasn't obvious. My background is almost entirely in pediatric oncology. I did all of my, what we might think of as, hospital nursing there. And then even in my academic role, my research is focused around pediatric oncology. So that is my wheelhouse. And tonight we have a very lovely panel for you. And I think that we will, between everybody on the panel, maybe even me, we can answer all of your questions. And thank you for giving us an indication of what it was that you were interested in. So the way that we'll work tonight is I'm going to do a quick introduction of everybody that's on the panel. You see that in front of you on that PowerPoint slide. Then I will turn it over to them to give a quick introduction of themselves, maybe 2 minutes. They can tell you a little bit more of their background. And I'll tell you a little bit, my quick view from 35,000 feet of the program and kind of, how it works. And then we're going to turn it over to you as audience members. You can certainly start typing in the chat and asking your questions, and we will have that moderated by Emma. And but we won't address them until we've sort of done the beginning blurb. But really, this tonight is for you, and we hope to answer all of your questions. So joining us tonight on our panel, our esteemed panel, Dr. Kara Seelock. Just give a little wave, Kara. I see her camera's on. She is a senior instructor, and she'll give you more about her background when she does her intro. Heather Bensler. Welcome, Heather, another instructor with us in our faculty. Dave Patterson. John David, as I like to call him, Dominic Chan and Crystal Benedict Chan. There's a typo there. That should be there, the class of 2014, not 2017, but Dominic and Crystal, can you give a little wave? They'll tell you about their backgrounds in just a minute. Kome Odoko, who is a Master of Nursing graduate from 2019. You probably just gave a wave and I missed it, Kome. And then we have two students that will be very, very valuable to you. I know for sure they're always probably the most popular people on our panel. We have Julia Gospodinov, I hope I said that right, fourth-year nursing student who is also on our undergraduate nursing society as BP academic. And then Keelan Fensky, who is a fourth-year nursing student, and she is our UNS president, our undergraduate nursing society president. So welcome to everybody. We also have in attendance Emma Lockyer. You heard her voice at the very beginning. She is a program specialist in our undergraduate program office and will be, like I said, monitoring our chat. And then Carly Statue from recruitment team, who can also help answer some questions. And I think I also saw Lindy Ephraim in there as well. So Lindy is one of our student advisors. So rest assured, you have a lot of minds here that I can't imagine there would be a question that we can't answer. And the purpose of tonight is to talk a little bit about our program and also to give you a taste of what nursing career could look like. And we have a diverse representation here on the panel. That's the whole point. But real quick from me, we have three cohorts or three routes of entry into our program. And hopefully this is repetitive for you. Hopefully you know this already. But our biggest one is our direct entry. And so those are the students that come right from high school, and they would do the typical full 4 years, fall, winter times 4 years. And that at the end of that would graduate, once they write their licensure exam, would become a registered nurse. And then we've got an accelerated route that is comprised of two different types of students. We have transfer students. So those students come to us with a certain number of university courses, I should say, along with all of our prerequisites. And then we have a degree holder route, which is, as the name implies, students with a previous degree, again, along with all of our prereqs. And so those last two cohorts, the transfer and the degree holder, go through in just a little bit over 2 years. And so that really is the routes into our program. If you look at it from the full 4-year perspective, our first year is done away from our faculty in the sense of you do all of your non-nursing courses first. You get all of your options out of the way, and you do the things like your statistics and your anatomy and physiology, and all of those things are not typically nursing courses, but they are nonetheless extremely important. And then once you're in year 2, which we call all of our semesters terms, so the first semester semester of the second year would be term 3. There would be a community focus, and then your theory generally complements your clinical placement. Term 4 would be a long-term care. That's maybe the one exception here. In term 4, your theory is kind of from birth to death there, but the clinical focus is in long-term care. Term 5 and 6 are both medical surgical placements, and then they have an acute care focus and then a chronic illness and disease focus respectively. In term 7, so now you're in your final year, your first semester of your final year, it's the first opportunity you have to choose an area of focus. And we don't call it a specialization because you're not becoming a specialist. It's just an area that you might choose to have an extra, well, as the name implies, an extra focus. And so there's 5 to choose from. We have oncology, perinatal, older adults, mental health and mental health and addiction, and child health. Those are the 5 areas. And then your final term, term 8, is what we call your preceptor term. And so in that term, it's almost entirely in a one-to-one environment with a preceptor, usually in a hospital environment. Doesn't have to be, sometimes it's in the community as well, or other different kinds of environments, but it's typically in a hospital environment. And there's over 350 hours that you would do in a one-to-one basis. And then after that, you would write your licensing exam and then be on your way to being a registered nurse. So that is my overview from, like I said, from the view from 35,000 feet. I am going to turn it over to our panelists and to give just a quick introduction of themselves. And then please, like I said, please start typing in the chat as questions come up, and we'll get to them in just a little bit. But Kara, why don't we start off with you?
Sure. Thanks, Catherine. Hi, everybody. I'm Kara Sealock. My background's in primarily acute care. So I graduated from Calgary, actually. This is my alma mater. I'm a U of C grad from way back when, from the CCNP program, actually, which is a conjoint nursing program that we had years ago. So I'm all for Calgary. And after I graduated, I started working on a rheumatology unit. And then 6 months after I graduated, I moved to ICU and CCU. And I worked critical care for 14 years there. I've also done endocrinology research, and cardiovascular pharmaceutical research in that time before coming here. So that's my background.
Thank you very much, Kara. And Heather, next, please.
Awesome. Thank you so much, Catherine. My name is Heather Bensler, and I'm an instructor at U of C. I'm also a graduate of the University of Calgary program 25 years ago, or a little longer than that. So in my career has been quite varied. Probably the most exciting thing that I did is I worked in Peru and Ecuador in the jungle for 3 years, helping to create medical training programs for Indigenous leaders. And then I came back to Canada and worked as an obstetrics nurse, so helping to deliver babies at the Rockview Hospital. And then I went into nursing education. My focus has been mostly on Indigenous health, also on international and global health. And the focus of my research is anti-Indigenous racism. And right now I teach in term 3. So I teach the community health course, and I also teach in palliative care. And I'm excited to pretty much chat about anything related to nursing. Thanks.
Thank you, Heather. How about Dave next, please?
Hi all, I'm Dave Patterson. I'm another double grad actually from U of C with both master's and baccalaureate and master degree in nursing. I came to nursing a little bit later. I was in my 40s when I graduated, but I spent about 10 years or so in working with neonatal intensive care unit for level 2, which is the sick kids, but not the really sick kids, and working as a community health educator, teaching, working with dads that are about to be dads and what it's like to be a dad. So that's me.
Thank you, Dave. How about Crystal and Dominic next?
You want to go first? Okay. I'm Dominic. I'm a U of C grad as well. Graduated 2014. Actually, at the pleasure of being taught by Kara and Dave here. So Crystal and I both, we were in the same class. I started my career in Calgary, working in a variety of areas, medicine, surgery, and mental health, adult and adolescent mental health. When I moved to Vancouver, I became a coordinator for a mental health unit, and I'm currently a program manager for mental health and substance use in North Vancouver.
And during your master's.
Oh, and I'm doing my master's. Yeah.
My name's Crystal. It's basically everything Dom just said. Graduated in 2014 from University of Calgary. I'm currently in my master's as well at the University of British Columbia, taking a newer master's called the Masters in Health Leadership Program. So it's focused on business and clinical education. I started my career in inpatient mental health, so working with individuals who are quite ill with mental illnesses in the hospital, and then worked in an STI clinic, sexually transmitted infections clinic in Calgary, and then we moved over to Vancouver in 2018. Since then, I've been working on the downtown east side, which is where a large majority of vulnerable folks reside in Vancouver, so lots of addictions, mental health issues, and then increasing complexity with the COVID-19 pandemic. And I recently obtained a position as a clinical resource nurse, which is kind of like a frontline educator equivalent in Alberta, where I'm working with individuals, again, in the downtown east side with COVID-19. So yeah, thanks so much for having us.
Thank you for being here. And Komei.
Hi folks, I'm Komei. I graduated from the MN program in 2019. I completed my bachelor at the U of A, and I worked in Edmonton briefly in pediatric and adolescent mental health before moving to the University of Calgary, and I work here as our case management coordinator for our student at risk team, which is a reporting portal for folks to connect students with resources that anyone can access. A lot of my work looks at supporting crisis management at the university here, supporting faculties with their mental health directions. I do some EDI work. It's a bit of a mixed bag all the time, but I get to work with both faculty, staff, and students for the majority of my role here. Happy to be here this evening.
Thank you, Komei. And Julia.
Hi, everyone. I'm in my 4th year of nursing at the University of Calgary and was a direct entry student. I've had experience working on cardiac, renal transplant, and I'm currently on a med-surg unit. I have also had the opportunity to work as a research assistant for the Faculty of Nursing and am a 2-time Peer Award recipient, which is the program for undergraduate research experience. And I also work as the VP academic for the Undergraduate Nursing Society.
Thank you, Julia. And last but not least, Keelan.
Hi, everyone. Thank you so much for having me tonight. As mentioned, I'm Keelan, and I am currently in my 4th year of nursing, so I'm in term 7, as Dr. Lane mentioned. I have also had experiences on renal transplant unit cardiology, and I'm currently also on a med-surg unit in my older adult placement. And I am the president of the Undergraduate Nursing Society.
Wonderful, thank you so much. So that is our panel that from whom you can ask questions and we can share experiences and hopefully answer whatever burning questions you might have. I don't see any questions in the chat yet, unless Emma, we've got this set up such that we don't see them and it's just you that sees them.
No, unless someone sends them directly to me, they should be seen by everybody. So
okay.
Chat is open, folks. Feel free to start asking questions. Catherine, do you want me to start the panel off with a question?
Sure, go ahead.
All right.
I can follow up. Yep.
What do you think sets the University of Calgary's nursing program apart from other nursing programs?
Heather has a great vantage point, having worked several places.
Yeah, I've taught in a couple of different nursing programs. I would say a couple of things. One, I think University of Calgary really gives a very solid understanding of what nursing is within kind of the box of what needs to be addressed. And I would say all nursing programs do that. You can't be a nursing program without actually addressing that. But I would say U of C really specializes in giving students an understanding of what nursing can be. And that is introducing them to really creative ways of joining your passion with what nursing can be. And so that might be in the community, that might be as a researcher, that might be in unique roles. In fact, we've even had students leave our program, graduate from our program, and start new roles in nursing that didn't exist when they were students. And so that makes me really excited. The other one is we have a lot of opportunities for research, as Julia mentioned, and also opportunities to really connect with the community. One thing Julia didn't say is she's also helped me a lot with our international global health program. And so that is like engaging with newcomers and refugee populations within Calgary. And so kind of finding that intersection between our kind of social justice angle and passion and also nursing. And so, yeah, I would say those are the things that make me the most excited about U of C.
I'll add to that just one thing. That in Canada, of course, we don't have Ivy League schools like they do in the United States. It's much more, well, it's just not like that. But what we do have is something called the U15 Group, and what that means is there's 15 universities across Canada that are considered to be research intensive, and University of Calgary is one of them. And so because sort of like that might imply, we have a very intensive research focus. It does not mean undergraduate students need to do research, but it does mean that we teach you very explicitly and very well how to understand research and evaluate it and incorporate it into your practice once you graduate. So that would be another thing that really differentiates us from, say, a non-U15 school.
Excellent. So we've got some questions trickling in. Some of these are being sent to me directly, so you might not see all of them in the chat. Can a few of the panelists explain in plain English what exactly some of the things that graduates with a nursing degree can do?
Dave, why don't you start us off?
I was trying to find the mute button there. Pretty much anything you want to do. We have graduates that are teaching. We have graduates that are bedside nursing. We have folks that are doing research. And we've got a lot of people that you might not think are nurses. There was a couple of Calgary aldermen in older people, counselors is the new name. Counselors is the new name, I'm old. That were registered nurses. They both retired, but they were on council for a number of years. I think that for me, it's a chance to give back. It's more altruistic, I think, is why I became a nurse, rather than being able to take, to keep taking from people, is a chance to give back. So I don't know, Kara, what do you think?
I think over the past, since I've been here 11 years, opportunities have really opened up for our graduates in ways that they never had when I first started, which is actually really quite exciting. So when I first started, students typically didn't start their positions after they'd finished their fourth year in a critical care area or in a NICU or a specialty area like obstetrics. But I think our program does a really strong and solid job at preparing our students for specialty areas where before students would begin on multiple units in community practice and in acute care units in the hospital. But now opportunities have really opened up. One of the great things about our program is that we have a lot of connections and a lot of relationships with our community members, as Heather mentioned, but also within acute care practice. So as you can tell on the panel, Crystal and Dominic were our students. Keelan was in my class, Julia was in my class. And as students move out into practice, a lot of us instructors remain in contact with students because now colleagues, because we really are one profession. And I think that's another unique factor that sets our U Calgary apart, is that we have a lot of graduates on multiple units in multiple places in Calgary, and they take our new graduates under their wing and kind of guide them along and mentor them and help them out as they transition into a practitioner.
Are there does anybody want to add to that?
Yeah, I can add to that. So I guess I'm going to take it a little different angle. One is that you don't have to retrain to do all of these different jobs. Once you get into a higher level of nursing education, or maybe as a researcher, you would do a master's degree. But I went from teaching in the perinatal education program, so being a prenatal instructor like Dave was in the community, to working in the jungle, to working as an obstetrics nurse, and all of that with an undergraduate nursing degree without retraining. So I think you just have quite a variety. Now, it doesn't mean it was easy to go from working in the jungle to being in obstetrics, so delivering babies in the hospital, but I was able to do that as an undergrad with an undergraduate nursing degree.
Thanks, Heather, very much. Emma, how about the next question?
All right, our next question is, can you talk some more about the direct entry process? So our focus tonight isn't admissions, but maybe I'll have Carly jump in quick and just give us a high level of how the admission process is going to work.
Hi there. Sorry, I haven't been listening too much. There's been some issues with the link to access the event here, so I've been just kind of watching my emails here. Sorry, the question is, how do admissions work?
Yeah, they're just wondering about the direct entry admission process, so straight out of high school.
Oh, excellent. Well, direct entry just simply means, yeah, you're coming straight from high school. You don't have any post-secondary credits. So basically, once you take 4 or more post-secondary classes, then we'd be looking at you as a post-secondary transfer student. And as a post-secondary transfer student, we would be looking at, you would still need the required high school courses, but in addition to that, you would also need the GPA. You need to meet the required GPA with your post-secondary courses. So if you're planning on taking post-secondary, a few courses, some people think that it might kind of help them get a jump start on their degree. That's not always the case. Sometimes it is best if you take the courses you need for your program in high school, and you kind of just stick with those high school level courses and do the best you can on those courses to get the GPA you'll need to meet our admission averages for the program with high school courses exclusively. Does that help answer your question?
Yeah, I think we just add on, I guess, for nursing students, the required courses for direct entry admission would be English 30-1, Chemistry 30, Biology 30, Math 30-1 or 30-2. We actually accept either of those, and then a 5th approved option course. Yeah, as we said, this admissions isn't kind of our main focus tonight, but that gives you a little bit of an overview on that. Our next question, how did some of the students decide nursing was what they wanted to do? What aspects drew them into the program?
I can start. So for me, I know this is so very typical. People think nursing is about helping people. So I was also one of those people who I said to myself, I would like to help people. I also really was fascinated with medicine and anatomy and biology, and that was my favorite subject when I was in grade 12. So for me, I wanted to combine helping others and making change and using my brain and thinking quickly with that science aspect and thinking about anatomy and how everything's connected. So I think that's about it for me. I don't know if Julia wants to add anything to that.
Yes, I was very similar. I also really enjoy how nurses are always on their feet, moving and having to challenge themselves critically every day. So I think that was a big aspect of me as well.
Awesome, thank you. Our next question is, what is your opinion on going into nursing before medical school? Okay, I'm going to start this one off from our advising perspective. Nursing and medicine work side by side, but they are very different professions. It's not to say that nurses don't go into medicine, because they absolutely do, but I would caution you to do your research. A lot of medical schools do have science prerequisites that you need to take, and the nursing program is so structured. You get very few option courses that can be challenging to get those, and I've seen a lot of students decide near the end of their nursing degree that they want to go into medicine and struggle to try and figure out how to get those courses. So it's not to say you can't do it, but I would contact multiple medical schools and find out what their admission policies are and go from there. Not sure if anyone else has anything to add to that.
I could maybe offer some perspectives. Oh, Dr. Lynn, go ahead. I can probably speak after you.
No, go ahead. That's fine.
Just in, I think, talking with students and offering support, I think maybe some reflections on the kind of work that you're looking to do. If you're looking at medicine and nursing, I think some of the skills has, as mentioned, critical thinking, being on your feet, helping people are very similar. But I think a lot of self-reflection on the kind of work that you're hoping to do in healthcare and looking at, are these my only options? I think a lot of the times these are the two main ones, but is nursing really what you're interested in, or is it healthcare in general? There are multiple areas I think has been described tonight that you can connect, whether that's in education or in policy, or even in just IT, for example, too. Like there's a lot of innovation going on with technology right now. Is that where your passion is at? I think having more reflective conversations on what you're actually hoping to achieve long term. Is nursing something that you would like to learn more about and to see if you would fit, to see if the kind of lifestyle you're looking to live matches with sort of the nursing practice? I would probably recommend you chatting with any of the nurses on here, or any nurses you know in real life, to get a sense of what nursing day to day actually looks like, to see if that matches with what maybe the preconceptions that you have of what a nurse and a doctor does. Just some perspectives that we sometimes offer to students as they look to make this decision.
All right. Can you please briefly explain what the last year of the nursing program is like?
Maybe Dom and I can take this. Yeah, so our last year of the nursing program, we had it's pretty intense. So you're getting, you're really using all of those skills and knowledge that you've gained throughout the previous 3 years and putting them into practice. And it's really preparing you for professional practice. Your courses are all about learning how to become a professional nurse and transitioning into professional practice. We had a final practicum, which we had some choice in. So my final placement I did at the STI clinic that I was eventually working at. And it's basically you're paired up with one-to-one with a preceptor, and you're doing the job that a nurse would with supervision. So it was a really good opportunity to kind of get your feet wet in the actual nursing profession while still having someone to look out for you.
Yeah, and it's so important. Well, not important. It is important to have someone there to provide you that guidance, because it is quite daunting. When you start a new job, you start like working with more and more patients, and in your last year, you really get that chance where someone gets to look over your back every once in a while and just provide you with that guidance to do things properly, because as you transition out and you go into the workforce, you won't always have that level of support around you anymore.
And I think so important to find that mentor in your last year too, which can be really helpful, and they can give you advice. Yeah.
One thing I'll add is you go in term 7, you go from being in what's mostly very large classes to all of a sudden, with the exception of one class, to being in quite small classes, sort of like 25 to maybe 50 is the biggest. And so that in and of itself has a different feel. And then in term 8, we actually have Dave Patterson here, who is what we call the nursing practice course coordinator, kind of like a lead of that term. And he's the one that's responsible for overseeing term 8, assigning students, et cetera. So Dave, maybe you can give more detail about term 8.
Sure. We're working on that this afternoon. We have 140 students coming in January to go into their final focus. And so far we have about 50 of them placed, which for this time of year is actually really good. It's a progression. The entry level, the junior level classes, terms 3, 4, 5 are very much 8 students and 1 instructor, and the instructor's on the unit all the time beside you. So they get to see everything you do. Term 6, it's still an 8-to-1 ratio, but you're spending more time with the students with the staff on the floor. And then 7, as Dom and Crystal said, and even Catherine, we go into more of a focused area, whether that's pediatrics or perinatal, something like that, older adults mental health. And that's very close. You drill down to get more levels of more knowledge for that area. And then when we go to term 8, the final focus is you and a preceptor. And that is a change, because now you've got somebody that is watching you all the time, that is a registered nurse. And we have groups of 10 to 12 students with a faculty advisor. And everybody on here has been faculty advisors in the past, so that's going to be good. Where we spend the time debriefing a lot with students about how things have gone and what people have seen and how it affects them and their practice. And these final focus, right now, I think we've got a lot of few emergency rooms placed, a couple of operating room placements done. Some community, we've got folks that will be going up to high level Fort Vermilion this winter. I currently am working with 2 students in Dawson Creek right now that are having lots of fun and seeing what it's like up there. And it's a chance to kind of branch out. And if we have the availability to not only work within Calgary, but within a lot of rural places fairly close, or even at distance, whether I think I've got 1 student out on Vancouver Island right now, a couple in the interior, as I said, up in northern BC, all the way from Cold Lake down to Black Diamond right now. So it's a good chance to put yourself out there while still having the backup of your preceptor, so you can stretch yourself more, but still have that safety net.
All right, our next question is, what made you decide you wanted to become a nurse?
Didn't we answer that one already?
We talked a little about the current students, but we didn't get into any of our alumni or instructors.
Okay.
I actually always said I would never be a nurse because my grandmother was a nurse. She graduated in 1924. My mother was a nurse. She graduated in the late 50s. And I said that I will never do that. And I was adamant and went into education, and then met somebody who was actually a physician who had worked in Africa for about 30 years. And I listened to her speak and I went, oh, that's what I want to do. And so I talked to her and she said, whatever, I'm going to give you advice. She says, become a nurse. She says, if you really want to make a difference, become a nurse. And she said, if you want to do medicine at some point, go ahead and do it. But if you really want to make a difference, I encourage you to become a nurse. So I actually switched my major thinking that's what I was going to do. And then when I was in nursing school, I was convinced I was going to go into medicine. I was going to do nursing and then medicine. And then I actually fell in love with being with patients. And I loved just what I saw nurses do, and how, like other people have said, fast-paced and thinking and critical thinking, but I really loved building relationships with patients and being with them, focus time. And so that's actually, I went in a little bit reluctantly and I've never left. So thanks.
How about Crystal and Dominic? Do you want to answer that one too?
Sounds good. You go first.
Yeah, I was interested in a couple different areas. I like different things, and I like learning about different things all the time. And nursing stuck out a little bit more just because, it gave me an opportunity to make, again, that lifelong change that we've talked about. But I've always still been interested in other fields. In nursing school, like Heather, I was also interested in medicine. And then when I went out of nursing, I was like, oh, maybe I could go back and be an engineer or try something different out too. I just like learning about different things. So, but the one amazing thing nursing gives you is the opportunity to try so many different areas out, and you can work really anywhere. As I've said, like I work in administration right now. Most of my job is business right now. And as recent as today, I was sitting in a meeting learning about engineering and types of doors that we have in a new build in a hospital. So there's just, it's so vast, the places you can go with in nursing.
Yeah, I think that was pretty similar for me. I always joke that my parents brainwashed me into becoming a nurse because I've always known I was going to be a nurse, like from the moment I was like 3 years old. I knew I was going to be a nurse, which is funny. There's no nurses in my family or anything. But anyways, always be a nurse. And I think just the connection to people. And I always I value that so much. And as I transition into becoming a leader or an educator, I want to make sure that I don't lose that. Yeah, that's what brings me joy every day in the job is seeing patients do well and helping patients. And that's really what brings me the motivation to get up and go to work every day. So yeah, that's kind of more touchy-feely side of it, but and obviously like so many options, so many opportunities to travel. I know Dom and I have talked about like going down to Seattle maybe for a little bit, or even like I traveled to Nepal and did some travel nursing, which was amazing too. So there's just the opportunities are endless with nursing.
Thank you very much, you guys. Why don't we move to the next question? I'm aware of our time and I want to make sure we get through every question here.
What is the main difference between health sciences and nursing?
I'm assuming that's community health sciences and nursing.
Probably the Bachelor of Health Sciences program would be my guess.
I can't answer that. Emma, you might even be in a better position. Oh, Heather, go ahead.
Yeah, my son actually did both. So we do often get students who have completed a health sciences degree and then they come into nursing. So a health sciences degree is very research focused as an undergrad. Graduate program. It's in the Faculty of Medicine. That doesn't mean you get into medicine right after, but a lot of students are aiming to get into a specialty program from the health sciences degree. And they take science courses, like some biomedical courses, some physiology courses, and then also some research courses. The expectation is that you will do a kind of your final year that you would do some, yeah. And then I guess nursing, we've already spoken to that. So nursing would be much more like hands-on, yes, doing science, but through the lens of nursing. And I think we've spoken quite a bit to that. So they are very, very different degrees. One is much more academic and research-based.
Thanks, Heather.
All right, we've got a couple of admissions questions popping up, so I'm just going to summarize a couple of them quickly. We've got questions about the current average to get into the nursing program. So nursing, we're obviously very early on in the admission cycle. We typically admit in the high 80 to low 90% range. We also have a question about the CASPER test. The University of Calgary does not require the CASPER. Some other nursing schools use it. We do not. So we'll just cover those off quickly. Next question is, once you are working as a nurse, can you switch your specialty whenever, or do you have to take courses in that specialty before you can enter?
Kara, can you start us off with that one?
Can you say that again, Emma?
Yeah. Basically, the question is, once you're working as a nurse, can you switch specialties whenever you want, or do you have to take courses in that specialty in order to be able to move around?
That's actually the beauty of nursing. We have the opportunity, especially in undergraduate, that you learn the basics for every program. And then if you want to move, let's say, from a medical unit to a medical unit, that's okay. Or a medical to a surgical unit, that's okay. Obstetrics to Best Beginnings program, which is a community program, that's okay. If you want to go from obstetrics back to medicine, that's okay too. If you want to specialize in a specialty area, like Dave works in NICU, I've worked in critical care, Heather's in obstetrics, there are certain courses that you will need to take in order to work in those specialty areas though. They require some extra certifications and some a commitment to the units that you are working on.
Does anyone have anything else to add?
Yeah, I'll just add in here. So Crystal and I live in BC, and it was a small difference when we moved out here as well. But stuff like working in ICU and emergency, for example, in BC, we have a 6-month course where you're actually employer paid. Your employer sends you to complete full-time additional education for those specialty areas. So that exists in different places in Canada and in, I guess, the US as well.
Thanks, Dom.
One of the nice things about some of the rural nursing and the rural opportunities is you get to try your hand at a number of different areas because of the, there could be, well, I've got a student down in Black Diamond right now. They have 4 nurses. The last week they had 3 patients. This week they have 14. And so they all really do everything from emerge to delivering babies to long-term care. It just depends on what walks through the door.
Awesome. In a somewhat related question, is it difficult to go straight from the nursing program into an ER nurse position?
Dave, I was thinking you would be at a good vantage point for that one, considering you see that all the time.
It is, as Kara said earlier, 4 or 5 years ago, we would have told you, no, you need to work on the units on a medical unit or surgical unit for a couple of years to get some time management skills and to see what it's like to work with 5 or 6 or 7 patients at one time. The way things are working now, they are taking people into non-traditional areas for practice, such as ER. We've got people that are doing my young lady that's in Dawson Creek right now, working in the emergency department. They've offered to pay for her transfer up there, to pay for the emergency nursing course, a lot of other certifications that are needed, just so that she can come up there and work with them. If she's not comfortable, they've offered to put her on the floor for 6 months and then put her back down into emerge. So there's a lot of things that are available now that weren't available even when Crystal and Dom graduated, which is, it's good to see you have more options out there.
Thanks, Dave.
Right. We've got a couple of questions on becoming a nurse practitioner and what that process looks like.
I can take that one. So a nurse practitioner is considered a graduate degree. So typically the way schools run it is as a postmaster's diploma. So in other words, you would do your Master of Nursing or Master of Science in Nursing first, and somewhere along the way you apply to, if that school has it, to their nurse practitioner program. And if you're accepted to that, then you would have finished your master's degree and you go right into the nurse practitioner program, which is an additional, well, it depends where you go, maybe year and a half, 2 years. And so that's typically how that process works. It's a very, very competitive program to get into. Our program, for example, only takes 6 or 8 a year. That's the whole class, right? So it's not much different elsewhere, but that's typically how a nurse practitioner program works.
Great. What is your opinion on how the pandemic has changed the nursing profession?
We can take that. My life has changed dramatically since the pandemic. I now have a new job out of the pandemic. So I guess the silver lining in everything that has happened over the last 2 years. You know, I think we've really shifted just to make it our new normal. And at first it was absolutely crazy. As everyone knows, it was kind of just putting out fires every day and just responding to the most important tasks. And I think as time is going on, we're learning that this COVID thing is not going away and that we're learning to adapt. And yeah, it's the new normal, unfortunately, as we know, but I don't know.
Yeah, it's polarized healthcare. It's been there's been a lot of from the managerial point of view, there's been a lot of vacancies. A lot of people have retired and left the position, and there's definitely a need for a lot more support on the front lines. There's a lot more jobs with the amount of patients in the hospitals, and there are new opportunities and new areas like where Crystal's working that have just been created from the pandemic, which adds to the amount of areas you can work in. So.
Come into nursing, we need you.
Great. Next question. What does a typical day as a nurse look like in a hospital or clinic setting?
Why don't we turn that to our students? They're the ones who are doing it day in and day out. Keelan or Julia?
I can go, Julia, if you want to go after. So at least for students, when you are placed, at least in term 7 and as well in your 3rd year, you'll have evenings or days. So you'll come on the unit, you'll meet with your group, and sometimes you'll have what's called a pre-conference and meet a little bit before, have a quick chat, just discuss plans for the day, goals for the day. And then when you're on your unit, you're going to get your patient assignments. So you'll probably start out with 1 in your 3rd year, and then you'll progress to 2 and possibly 3 and 4 in your upper years. So once you have your patient assignment, you're given time to research. So you get to know your patients a little bit, find out what you have to do, what you're looking at. You go through what's called your orders. So you're looking at what you have to do during the day. And then you look at what medications they're taking, just kind of get a bit of a clinical picture. And then you'll go out and you'll be paired with a nurse or matched with a nurse who has that patient assignment. And then throughout your shift, you will work with the patients under that nurse's care, but you'll offer help and then kind of communicate back with them what you're doing, what you found, how things are going. It's very, very open, and you're communicating constantly just so your nurse is aware of what you are doing. And then, yeah, you just kind of go through a day. You have medications to give, you have things on your checklist to complete, whether that's changing a dressing or doing vital signs, or maybe your patient has a procedure or a test. So you're going throughout, you'll know what you're going to do during a day, and then it's kind of mapped out. Obviously, things can change depending on patient status, but you'll work with your nurse during the day, kind of take your breaks, and then at the end of the day, sometimes students leave a bit earlier than a nurse's shift would end, and then that time is taken for a post-conference. So again, you'll debrief about your day, what you did, what you learned, other things that you might have seen, and then other instructors might go over different concepts to help you prepare for future practice. I don't know if Julia, if you have anything to add to that.
I think that was pretty spot on. I would say it isn't as scary as you think it is. You are very well supported. You have one instructor that looks after like 8 of you guys on the unit. And you have your primary nurse to speak to throughout the day. And at the beginning, you're almost side by side with them. But as you progress through the higher years, you become more and more independent, and you're just checking in with them throughout the day. So you are very well supported, and it is a great learning experience.
Awesome. Our next question, what are some things that prospective students can do to prepare for university and specifically for nursing school?
I could probably answer this. I think it probably comes up in our office quite a bit. But I think a lot of it is really time management. I feel like that's probably a really big area that can be a challenge, sort of build some of those skills in, and I think kind of translates throughout the program and even into practice as well. So looking at how you manage your time, and that can be anything from making sure that you're showing up when you say you're going to show up. That could mean actually putting in the work that is necessary, seeking help. A lot of those behaviors, I think, will support your learning, but also help you connect with the faculty here as well. I think part of the teaching is supporting your learning and you being a part of that process and being an active participant. So I think looking at time management, being able to effectively communicate your needs to your instructors and say, these are the areas that I feel like I would like to work on. And, I think also learning to receive feedback in a way that's constructive and being able to build that into your practice. I think finding different ways, and you can get that from your family, from your friends, your volunteer opportunities. These are also really great places for you to connect and build some of those skills.
All right. Our next question is, how do you get into travel nursing? I can touch on that briefly. Part of my role is supporting alumni seeking licensure in other jurisdictions. So a lot of our alumni who go into travel nursing work with agencies, if they're going especially to the US, that will help get them placed, help get their license sorted out, all of that. But you typically, you do have to work, you have to get the job, you have to get a work visa often, and you do have to get a nursing license in the province, city, state, country that you are wanting to work in, which typically involves providing them with a number of documents about your degree. And I know Heather had said a couple things in the chat, so if she wants to chime in, I'll let her do that.
Yeah, so I had a number of students this past year that were really excited about travel nursing. So we actually brought in 4 travel nurses and we did a panel just like this and shared all about travel nursing. So once you get into the program, there's lots of opportunities, especially now that we understand Zoom, to answer those kind of specialty questions. And what they said was 2 years of practice, usually in the hospital, because that's the type of work that the hospital or the travel nursing agencies are asking you to do. So getting a variety of experiences in the hospital so that you're really confident and competent. And then you can go, as Emma said, to the United States, across Canada, and across the world. And yeah.
All right. Does the nursing program require a lot of practical work?
Yes, that is the bread and butter of our program. I'd say we have over 1,100 hours, what we call clinical hours or practical hours over the course of the degree. And so, you know, you go from, I forget the math now, whatever per semester, but once you hit term 8, the final term, it almost doubles. And so that's really almost entirely practical hours there. So yes, there's lots and lots of practical hours.
All right, we're getting more admission questions, so I'm just going to touch on them quickly. We've got questions about, is it very hard to enter the program as a degree holder? Well, we have our degree holder route. We also have a question, are transfer students priority before direct entry students? No, transfer seats and direct entry seats are completely separate. You are not competing against each other for admission. And what path could I take if I'm not accepted to the program on the first try? So you've got a few different options. We're not going to get into detailed admission advising tonight. I would recommend contacting us. Our email is nursing@ucalgary.ca, and we can give you some more detailed information about our program routes. We've also got a question about scholarships, and I see Carly's put a link in the chat with instructions about how to search for the nursing specific awards. So thank you, Carly. Are there any additional requirements for students applying to UCalgary from different provinces in Canada? I see Carly shaking her head here. No, there's no additional requirements if you're coming from outside of Alberta. Are a lot of the classes online now due to COVID?
Our theory classes are all online. And we made that decision specifically because, well, primarily to protect our clinical hours. We're different than other faculties, right? We are in direct contact with COVID patients, and that is just in of itself a whole different thing to deal with. And so as a teaching faculty, first of all, for the fall this year, and then for coming up for winter as well, we met to make the decision about what are we going to do. And we made, again, the decision for winter that we are going to stay online for theory in the interest of protecting clinical, which we have been very successful at. As you can probably imagine, theory we can do online. Not everybody likes it, but we can do it online. We cannot replicate a clinical environment online. And so that's the rationale for that decision. Hopefully, I mean, I don't even want to say this out loud because I think I say this every term. Hopefully next term we will be in person. Hopefully in the spring we'll be in person. I'm just going to give up on guessing this now, but that's the way we run it. And we've actually gotten quite good at it.
Forgot to unmute myself. Do you still have clinical practice in first, second, and third year?
So we're 4 years, right? We're a 4-year program for the direct entry. So first year, no. Second, third, and fourth, yes.
All right.
If they come in as a transfer student or a degree holder, then yes. All of your years would have practicum.
All right. I think we've covered off pretty much everybody's questions at this point. We had some questions about professional licensure and taking time off, of nursing, which I believe Heather answered in the chat. You do have to complete a minimum number of hours over 5 years. But nursing is a pretty flexible career choice. We'll just give it one more second if you have any other questions, but we are coming right up to 7:30 now, so perfect timing.
While we're waiting, I just want to say a sincere thank you to our panelists for your time tonight, and as always, your expertise. Many of you come back year over year and share with our prospective students, and just it's very, very helpful and informative, and I really thank you. And to all of our guests that have come, we hope to see you in the coming years as students.
I don't see any other questions, so we'll close the chat off for the night. If you think of anything else later, you can always reach myself and Lindy, our advising team. Our email is just nursing@ucalgary.ca, and we're happy to help you out via email, and you can book an appointment with Lindy from there as well.
Have a good night, everyone.
Bye. Thank
Bye.
you.
Thanks.